Dr. Shauna Levy, assistant professor of surgery, Tulane University Medical Center, joins us now. I understand you specialize in overweight and obesity treatment, so you're the expert here.
Yeah.
Now that we have this drug, right, is it time to sort of rethink body positivity and return to, hey, if you're overweight, it can be really dangerous for your health. Here's something that can help you.
Yeah, I think, this movement confused people in many different ways because there was this assumption that just because big is beautiful, big is also healthy. And that was the disconnect. Obesity has always been unhealthful. And it's really not about size, it's about health, at least from my perspective when I treat this disease. And I think it kept people from going to the doctor because they felt like, okay, well, people accept me now. I no longer need to treat this disease, but it gets so confusing because you still need to treat it regardless of what you look like. It's just, they shouldn't be connected, what you look like and treating disease.
So how did this get confused? I mean, I hear you, and I think it's a fascinating way of looking at it. How did it get confused that somehow people were being told, hey, it's okay to be obese?
Well, I think this goes back many, many generations as people with obesity have been judged for their size. People honestly are judged for their size no matter what size they are. People with thinness are judged for being too thin, but I think because obesity is so prevalent, people with obesity are judged even more. And, I think people with a disease are frankly sick of being judged, and we're like, hey, we're still human beings. We deserve to have all the rights of everybody else. And therefore, we just want to say there's healthy at every size, there's beauty every size. Stop judging us. And I think that when that movement came forward, people confused beauty with health. And they thought the messaging was, because I'm this size, I'm also beautiful and healthy. When beautiful, sure, not debating that, but healthy is different.
Yeah, we heard for so long, even though, that doctors were told not to tell people to lose weight, even though it would help, even though it would save you money and increase your life expectancy and your life enjoyment and all these things. Doctors were told, hey, don't say that because it's going to offend people or hurt their feelings. Is that changing too now that you have this drug?
I think to some degree, but I agree with you that there's a huge lag when it comes to primary care physicians and referring providers to talk about treatment options when it comes to obesity.
Wow.
I've had doctors say to my face, I don't want to talk about this. I don't know how to bring it up, and I don't want to offend my patients. But is it offensive to tell somebody they have cancer? Is it offensive to tell somebody to stop smoking? Obesity should be no different. It really is not an offensive topic. You're just there to advocate for their health.
Fascinating. Doc, I appreciate your honesty, and I know there's a lot of patients who do as well. Thank you. It's good to see you. We'll have you back. We appreciate it.
Okay. All right. Thanks for having me.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.